Staff members holding a one-day unfair labor practice strike, accusing Kaiser of allegedly using artificial intelligence and unqualified workers to replace their work and worsen patient care.
Let's walk through this. I want to walk through this scenario together because I think so many times people are like have this idea of what AI is or what it's not and what it's supposed to do. So I walk into a hospital and they say, hey, I want you to take this assessment. We want to see how off the deep end you're having an episode right now. Okay, cool. If one or two things has to happen, if in fact Kaiser has been noted by saying they don't have enough providers, it is why they offered 20% more for the people they already have in place in New York. I'm going to say this because the hospital system won't say it. If the hospital system was understaffed by government guidelines, they would not be open. They're barking up the wrong tree, right? I've always said this, right? Government gives them a stand. You got to have so many nurses per bed, right? That's the thing. So then the question becomes, of that, how much does the nurse think is acceptable? That's where it kind of becomes murky, in my opinion. Do I think that AI chatbots for the mental health is good or bad? I think I like preloaded answers to questions. I like that. Right. I think I'm hearing too many stories and there was just a story recently of a gentleman who was having a relationship with AI in his mind. And the AI told him, for us to be together, you have to kill yourself, essentially saying, I'm in the afterlife, you come with me here. And that's what he did, supposedly, right? Supposedly. I haven't seen any proof of it. And so I'm like, well, I don't think those people who are already vulnerable should be entered into that space. But if it's preloaded questions, say, hey, how are you feeling? Are you like in pain? Or do you feel like hurting yourself, right? And I think with those answers are preloaded that go directly to a practitioner giving what you say, I'm okay with that. I'm borderline okay with the AI, borderline, because you're already in the place, right? It's not like you're at home having a crisis and you got to get you there because that's something you might do on the way.
Well, they are also looking at integrating AI into mental health apps through Kaiser, which is a separate story. One of the demands with this particular strike is that they want protections and guardrails in place to ensure that the AI assists and does not replace human judgment in the behavioral health assessment.
We just don't have enough behavioral health experts, but we generally don't. That's what I was saying before, like, I'm gonna call Jeremy. Jeremy Wooten is a nurse practitioner in behavioral health, and he works for a hospital system. Friend of mine, I'm gonna call him and ask him what he thinks and get you guys some feedback on that. But in my opinion, we don't have enough. That's number one. So then the question becomes, does the person just wait another hour or two for someone to come, right? Or even it could be longer in some cases. Or do we at least see how bad the situation is? Can we assess it through some type of chatbot system and rush someone to you? Ideally, mental health to me, and I'm gonna say this, two people come into a hospital, right? One is having a stroke and one of them broke their finger, right? You can pretty much physically see that the one with the stroke needs to be taken to the back first. I think most people would agree with that, right? Most people. If two people come in with a mental health breakdown, we don't really have how do we know which one is in worse shape? That would be my question, number one. If they could help us figure that part out to rush who's back first, you might be on to something. I'm saying because we can't see mental health. People are having mental health breakdowns in the grocery store every day. It's just how it's shown, we don't know, right? We don't know everyone, but I'm not against it. But I always ask my health professionals, my nurses, make sure your concern is always patient-centered and not job security centered. And as long as you can promise me that it's patient-centered, I'm with you. Sometimes I hear things that they say and I'm like, you're more so trying to protect your job. And it's like, okay, then I kind of go off a deep end because it's not gonna take away your job because we don't have enough of you anyway. But if it could help you and help determine who needs to be seen first, I like the idea. I'm just gonna be honest. But I don't like it being able to go on a tangent. I like preloaded answers to questions. And if we can't figure something out, then we put you higher on the list of an assessment level. Someone needs to go in quickly. I'm okay with that. That's my opinion, but I do want to hear what other people have to say about that. That's why I'm saying I'm going to call people.